We have Dr. Lynn Maxfield and Dr. Brian Manternach, Intro to Vocology. Dr. Lynn Maxfield and Dr. Brian Manternach are both professors at the University of Utah, Lynn in the School of Music and Brian in the Department of Theater. Lynn is also the director of the Utah Center for Vocology, where Brian serves as a research associate. They're also both on the teaching faculty of the Summer Vocology Institute, which recently completed the 20th year of instruction. In today's presentation, Lynn and Brian will provide an introduction to the field of vocology, looking at what it encompasses, what a vocology training program looks like, and how vocology relates to studio voice instruction.
Well, thank you very much. I appreciate that introduction, and thank you to the Cal West NATS Regional Conference for having us here this morning, and thank you for joining us, whether you are here in person. Thank you to the one who is so far, and to those of you who will join and watch this later. Thank you for taking the time. All right, so we can go to the next slide here. As we put in our description here, we're going to give you an introduction to what is vocology and kind of why should we care is the aim of today's presentation. So the first thing we're going to do is talk a little bit about how our center came to be, our history, who we are, and somewhat, I guess, who we are not. So we're going to start in the upper right quadrant there and go sort of clockwise here and start with the National Center for Voice and Speech. The NCVS was formed in the early 1990s using a large grant from the National Institutes of Health, National Institute for Deafness and Communication Disorders. That was the purpose of the grant was to create national centers of excellence, and the aims of those centers were threefold. One was to produce cutting-edge research. One was, or number two, was to disseminate that research and share it with the public and the broader public. And then number three was to produce educational tools to improve the future research as we move forward. So obviously our research history is long and rich. We've been doing this sort of research on the fundamentals of voice production and its practical application to clinical voice practice for going on 40 years now. And in an aim to meet the educational goal, we created the Summer Vocology Institute, which first ran as part of the curriculum at the University of Iowa. And then it sort of expanded into a larger summer program accepting students from around the country, across the country and around the world. And we've continued that now for, as we said, 20 years of the summer program. And then there was 10 or 15 years before that where it was at the University of Iowa. And in the past few years, so we started in Iowa at the University of Iowa, moved to Denver and was a part of the Denver Center for Performing Arts there. And then around 2009, we finally moved to the University of Utah, where we are currently. And a few years ago, we were looking through our aims, our threefold aims, and realized that the dissemination piece of our work of getting this out to the broader public was becoming more and more difficult within the university structure. And so the research and the education portions were very well homed in the University of Utah structure, but the dissemination piece needed its own home. And so at that point, about 2 years ago, we split up these programs just a little bit, and the National Center for Voice and Speech split from the University of Utah and is now its own standalone 501c3. And the research and education components stayed at the University of Utah, where we created and renamed ourselves as the Utah Center for Vocology. So we still have all of our excellent faculty, all of our excellent researchers, and of course, Dr. Titze is still on our crew. It's just we've switched up our aims just a little bit, and we're housing our research and education points now at the University of Utah. All right, so we can move to the next slide now that we've introduced who we are. A bit more about what to expect in the next 40 minutes or so, 39 minutes. We'll go into what is vocology, giving a definition of that, who is a vocologist, and what are the main areas of focus in a vocology training program, and then how can then finally, we want to bring it all the way back home to why should we care? How does this vocology training influence singing voice instruction? And more broadly, all extra, what's the word? Extra normal voice use training. So training for anything above and beyond normal conversational speech. Brian, I'll pass it over to you.
Excellent. So vocology still, though many of us have heard of the term, many of us maybe have experience with vocology programs or folks who identify as vocologists. If you look on dictionary.com, this is what it tells you. There are no results for vocology. If you actually go to the Merriam-Webster online also, it tells you this word isn't actually in the dictionary. So if you go to the word programs, you notice the one on the right, that's an older program. This one still underlines vocology as a misspelling, both the capitalized version and the lowercase. So Word, up until recently, the one on the left is the more recent program, didn't even recognize vocology as a word. Once you go to Wiktionary, our great source for all thorough definitions, finally we see an entry for vocology, a recognition of vocology as a word, but it's a very brief definition right there, very simply stated, the science and practice of voice habilitation. It does also recognize the vocologist as a related term to vocology. So you have to do some digging in the greater world. Again, in the voice world, it's probably better known, but in sort of the mass market venues, it's a little more difficult to find even what vocology is. And this very basic definition, science and practice of voice habilitation, is the subheading of the vocology textbook that Dr. Titze and Dr. Verdolini Abbott wrote, I think probably 2011, somewhere around there. So yeah, that text has been out for at least 10 years now. So again, it's a very brief definition and one that we hear used often. So we're going to break that down a little bit. But first, there was a recent paper Dr. Titze has written extensively and been interviewed extensively about what vocology is. He's seen by many as the father of vocology. And in this very recent paper that he published in this scientific journal serving Latin America primarily, again, just identifying what vocology is. And he says here that really in its broadest definition, vocology is just the study of vocalization, the ology part of it, the same way that musicology is the study of music. Any ology could be the study of. And he makes this comparison of how it's very similar to audiology as the study of hearing.
And so he put together this nice little diagram where he looks at across the top of this image, you see different uses of or study fields of voice and language and these professional fields of study. So we're going to start at the lower right side of this, and along the bottom of each of these columns, we see the scientific study portion of each of these fields. So for the perception of music, we have to study hearing science. For language production, then we need speech science, which includes the production and the perception. So it bleeds over a little bit over into the audiology side. But then for the vocal performing arts side, if we really want to study voice production, then we need something that focuses entirely on the voice production, not the speech production, and that would be labeled voice science. And if we move up a level, a tier in each of these columns, then there is a corresponding medical field for each of these, where in perception you have otology, in language perception, there's several medical specialties, but in particular laryngology, and then we have laryngology, of course, that focuses entirely on the health and function of the larynx. So then we can move up another level, and it makes sense then if we get not from the medical practice, but to the science and practice together. Then in perception of music, we have audiology. In the science and practice of language, we have speech-language pathology, but we need something more suited toward voice production, for the science and practice, and that field, that term they have coined is vocology. That really makes up what it is. In some ways, Dr. Titze notes that this is stepping back a little bit in time, because back around 100 years ago, as speech language pathology programs were developing, they were all growing out of communication studies departments. Those included things like oration and rhetoric and broadcast journalism. That's where, and theater arts as well. And that's where speech language pathology sort of birthed out of, or at least that's where it was housed in the academic units. And so in some ways it sort of makes sense to bring that back a level in terms of vocology. All right, so if we move on then, coming back to this idea of vocology is the science and practice of voice habilitation, then we can extend that and say that includes the evaluation, the diagnosis, and intervention for voice care, for voice habilitation. And we can see that fits our field pretty well. As singing teachers, we evaluate the voice. If we ascribe to Dr. Kinney's book of the diagnosis and correction of vocal faults, right? We diagnose and we produce some sort of intervention. So what is it that makes us not voice therapy? We'll get into that. All right, we can click to the next one there. And the emphasis in this definition then has to be on the habilitation rather than rehabilitation. That's what's going to separate our fields and help us know where our lanes are. So voice habilitation is therefore more than repairing a voice or bringing it back to a normal state. Can extend this and say that it is finding the ideal voice for that client for their specific needs. That is the heart of habilitation. All right, so voice rehabilitation for the performance voice is the restoration of lost vocal function for the performer who has suffered a voice disorder or a voice injury. I would underline that portion, that suffered a voice disorder or a voice injury. There's this important distinction that we can make here, that the loss of function that is as a result of either lack of training or stepping away from training for a while does not equate the need for rehabilitation. At that point, we are back in habilitation land and therefore firmly in the scope of practice of the singing teacher. All right, we can keep going. Voice rehabilitation then, we can pretty clearly say lands in the world of voice therapy. There is still controversy about this. There's still room to discuss this. Kari Reagan actually claims pretty clearly that she's at the University of Washington, that singing teachers can work in a rehabilitative state. I think that but if we go back to what I was just saying a bit ago of the voice injury as a result of injury or a pathology, then we need to step into the voice therapy range. All right, so the American Speech and Hearing Association defines voice therapy as a program designed to reduce roughness through guided change in vocal behaviors and lifestyle changes. We guide change in vocal behavior and lifestyle changes as singing teachers, but we're not going at it from the restoration of function as a result of injury or pathology. Voice therapy consists of a variety of tasks designed to eliminate harmful vocal behaviors, shape healthy vocal behavior, and assist in vocal fold wound healing after surgery or injury. So, continuing on, a certified from the ASHA, from the American Speech and Hearing Association, certified and licensed speech language pathologists are the healthcare professionals with the expertise needed to provide effective behavioral treatment of hoarseness. So this recognizing scope of practice is important, and understanding the differentiation between rehabilitation and habilitation can help us understand that scope of practice. I know I'm harping on this, but don't worry, there's only one more slide. Someone who is a vocologist may engage in voice rehabilitation and voice therapy, but training or recognition in vocology does not qualify someone to engage in voice rehabilitation or voice therapy. I would extend this then and say somebody who has additional training in speech language pathology does not automatically qualify to engage in habilitative care. if any of you have known speech language pathologists or have studied this field at all, you know that the scope of practice for a speech language pathologist is absolutely enormous. And there is no way that every speech language pathologist that graduates with a master's in SLP is going to have the expertise and experience needed to work on that habilitative care of taking you from normal function and beyond. All right.
So we come back to this idea of, again, habilitation. So we've differentiated habilitation from rehabilitation, right? So if the habilitation is then building and enhancing vocal skills, but also building and enhancing vocal knowledge in a healthy performer. So not someone who is trying to come back from an injury. This comes from that document from the NCVS way back in 2013 already, 10 years old here. So the habilitation component. So as we saw in that earlier definition provided in the Vocology textbook, we want to break habilitation down into the evaluation, the diagnosis, and the intervention. They also, in this text, Titze and Verdolini, refer to habilitation as the process of enabling, equipping for, or capacitating. So in this process, there may be building, there may be strengthening to meet a specific need. And this is very much what we do as singing voice teachers. We enable a voice. I think of enabling as perhaps the removing of inefficiencies to enable something to occur, as opposed to strictly building. The equipping for would probably be then more of the building specific techniques for a specific need. And then capacitating, I think of as sort of related to, in our field, maybe a vocal stamina. So we're capacitating someone to do this thing that we're equipping them for, but capacitating them to do it in greater capacities, in perhaps singing longer, perhaps singing louder, perhaps singing more specifically those tasks that are for a specific need. So it's interesting also, we have to emphasize this idea of science and practice. I think when people think of the ology part of vocology, they go right to the science and they think it has to all be about voice science. But there's a difference between voice science and vocology, as we saw on that chart that Lynn talked us through. So there must be a practice component as well. Kittie Verdolini, who teaches every year at our Summer Vocology Institute, this past summer, she said this and she emphasized this in class. She said that science follows practice and it's not the other way around. I think a lot of folks who are not necessarily involved in the science, the doing of science component, think of it maybe backwards. But Verdolini emphasizes that we practice first, and practice leads us to certain discoveries or certain questions that we then turn to science to maybe help us test. So we have to be engaged in the practice to know what questions come up and know what we have to study. Lynn, do you want to add on that?
Yeah, I'll just jump in quickly and say, add that even Nats, as we have produced our science-informed pedagogy committee, and they're continuing to work on that. This science-informed pedagogy sort of perpetuates that wrong idea that science leads the practice, and it has to be a symbiotic relationship. The practice has to be informing the new science. It has to be informing what are the questions that we still have. And Brian, what you pointed out quickly at the end there of we have to be engaged in that process as singing teachers is so important. And it's if any of you haven't studied the idea of the scholar practitioner model, it comes out of medicine where you've got these doctors who are very busy in their practice. They don't have time to take 60% of their time and go into a lab somewhere and isolate their research. And nor is their practice without value in answering questions. And so there's this model out there for using your own practice to form and test hypotheses to help you narrow down your practice in making it more efficient and more effective moving forward. You can be the scholar and the practitioner, and I think it's actually a beautiful model for us as singing teachers.
Excellent. So this idea of science and practice, I think, is actually reflected very well in this evidence-based voice pedagogy model that NATS has been embracing somewhat. And so this was proposed first by Kari Reagan, but then Lynn Helding, Ken Bozeman, and our own Lynn Maxfield have really helped flesh this idea out through a series of articles in the Journal of Singing. And so Kari just sort of borrowed from the evidence-based medicine model and applied that to voice pedagogy. And so you see this in the Venn diagram, that if you're practicing evidence-based voice pedagogy, it has to be a combination of these three elements. The student goals and perspectives should be an obvious one, but I think this comes to habilitating or equipping someone for specific vocal tasks, is that if they are intending to sing rock music, and you're teaching them bel canto and assigning them only the 26 Italian songs and arias, then you may not be equipping them for the task of singing rock music. You could argue that that kind of background and basis could be a foundation that could be extended into rock music, but if you never get to the rock music component, then you're really not practicing vocology. So the other component then is the upper left, the voice research. So we could equate this to the science part of the science and practice, is that someone practicing evidence-based voice pedagogy has to at least keep up with the science, know what's happening, know what's being published in the journals, know kind of the direction that the field is going. But it's not enough to only be involved in the research. We also have to acknowledge the teacher's expertise and the teacher's experience. This is the practice component. So there are things that we do in the studio that work, and we know they work because we have experience with them working to specific ends. We have to do those things. We should do those things until we know better. But even if we don't understand necessarily everything about why they might work or the science behind it, so we should keep doing best practices, but engaging in the voice research component, I think, also encourages us to question even the things that work to see if maybe there are ways that they could work better or ways that they could apply more specifically to individuals in front of us. So again, the science and practice model from Vocology is also very much reflected in this evidence-based voice pedagogy model that Kari Reagan started. And I encourage you to go back to the Journal of Singing and look at those articles. Lynn, do you have anything to add on that component?
I think it's a good model, and I would say that scholar practitioner model that I was just talking about, that really is the intersection between voice research and the voice teacher expertise and experience, and that's where the most fruitful voice research comes from. I would also note that in the article that I and Kari and I wrote to flesh out the voice research point, we do take pains to make sure that voice research does not equate to voice science, but voice science is a part of voice research. There's also all the humanistic research that is relevant to voice production and to artistic voicing and singing, that is all included in that voice research side of things. So it's a little bit broader, bigger tent than that.
Great. So if we get back to this then, and this is kind of the definition that we have formulated through our putting together this presentation by substituting some words from some longer definitions. So you could argue that a vocologist is anyone who, informed by science and practice, engages in the evaluation, diagnosis, and intervention for the purposes of enabling, equipping for, or capacitating the voice. So you can think of that quite easily and tie that into what singing voice teachers do. And I always make a specification between singing teachers and voice teachers, especially when I'm in vocology fields or talking to vocology folks. Because in the theater world, I'm in a department of theater at the University of Utah, voice is often associated with voice and speech or voice and text. And so it's more specifically referring to the spoken voice, the actor's voice. And so singing voice, even though in NATS we tend to just call ourselves voice teachers, I would like to promote the idea of us being more specific and calling ourselves singing voice teachers. So we can see how that applies. A singing voice teacher, again, in that evidence-based model, has to be informed by the science and the research, let that inform the practice, but we also let practice move back up the chain to inform the science. And then we engage in evaluating our students, diagnosing with both our knowledge of science and practice, things that we hope will will allow us to intervene in ways that enable and equip our students for the specific sounds they're trying to be making. So that gets us to the Pan American Vocology Association, which Lynn will talk about in just a second. But from this mission statement, I wanted to highlight two more things that come potentially as part of the definition of a vocologist. In this very first statement, the mission of PAVA is to advance the scientific and interdisciplinary study of vocalization across species. So I want to emphasize the interdisciplinary portion, and I want to emphasize the across species portion. So this is again from Dr. Titze's article that we've already referenced, where he discusses how there are many other species that vocalize, and they use it for very specific needs. He lists several of them here. So we as humans are not the only ones who express emotion vocally or who communicate vocally. And use this for a variety of methods and means. Ingo in particular is often referring to birds, the way that they vocalize, which is quite astounding for these tiny little creatures to make very loud sounds that travel great distances. So we want to be inclusive as vocologists. It's not just about singers, it's not just about humans, but we want to be more inclusive of the greater animal kingdom as well. And then this idea that PAVA is very intentionally interdisciplinary, where it doesn't just involve, as we saw on that chart, it's not just voice scientists, it's not just medical folks, but it can extend to this greater network of voice professionals. So we see speech language pathologists, we see ENTs and specifically laryngologists in there, singers and singing voice teachers, voice actor coaches, music directors, stage directors. There are many other fields, many other directions we could take that of those who work with human and animal vocalization. Still muted.
Yeah, rookie mistake. Yeah, thank you. Yeah, highlighting there the interdisciplinarity is so important, and if I can point to the part of the reason that we are emphasizing across species vocalization, part of it is curiosity and the good of science of understanding the world we live in, but also part of it is knowing that there are lessons that we can learn for our own practice in training humans from other species. We are not the only intelligent species on this great blue marble. Great, and to highlight that PAVA's membership is, as Brian very nicely put, intentionally interdisciplinary. It is intentionally interdisciplinary to reflect the interdisciplinarity needed for a true science and practice of voice habilitation. We need all of these different fields and all of these different expertises to make us who we are, to really understand and inform our practice. All right, so yes, the Pan American Vocology Association is relatively young. It was founded or incorporated in 2014. It grew out of a specialty meeting that I helped organize at the National Center for Voice and Speech in 2013, along with Eric Hunter and Marina Gilman and really just so many incredible people were on that committee. But the meeting was called Specialty Training in Vocal Health. What were the subsides? Oh, why, who, what, and how. And the need for this meeting was evidenced by several heated discussions on online chat boards where people feel more comfortable to say things than they would in in-person conversation. But where there was this recognition, I know we're getting back to what I was talking about earlier, of a scope of practice problem, where people were not sure who should be doing what and why. And who needed, what would the training be that would be required in order to level that playing field and bring the people who wanted to be doing voice habilitation up to speed. And so we had this 2-day meeting. It was actually an excellent meeting, and the document that Dr. Manternach has referenced already once earlier in the slides, there's a final report from that meeting, sort of listing out sort of the recommendations from that came out of that meeting. But on the final day, in our final plenary discussion moment, there was a lot of on the floor discussion and back and forth, and it was birthed this idea that we needed an association that could be the professional organization that would oversee habilitation and habilitative care. And coming back to Brian pointing out that Ingo likes to talk about bird vocalization, we were talking about what would we call this? What would we call this? And we said Pan American Vocology Association. And Ingo, and pardon me if this is too loud on the microphone, but Ingo goes, yeah, and it could be like a bird call, pava, pava, pava. It was hilarious. Yeah, maybe you had to be there. But if you were there, you knew that there was a whole lot of enthusiasm. And so we incorporated this new association. And one of the principal charters of it was to develop some sort of standard for measuring up who should be doing habilitation and calling themselves a vocologist, and maybe who should be doing other practice. And so thus ensued 7 years of hard work of several committees trying to iron this out. And what they've come up with, and they just rolled out this last year, was the PAVA recognized vocologist, the PAVA RV. And Brian, you were on the board during much of that time, so I'm going to let you talk about a little bit more about what that is.
Absolutely. So again, highlighting the interdisciplinary, multidisciplinary, as they call it here, they give an even more expansive definition of what professions may fall within the vocologist title. So we have our acting voice habilitation. We also have choral conducting. I think all too often our choral conducting friends are not necessarily recognized in the same sentences, but very much so can be under the vocology umbrella. We have the manual therapy and bodywork component, the music education folks, and then several of the others that we've talked about here as well. So we rely on each other, and specifically in the PAVA recognized vocologist definition, they want to intentionally bridge the disciplines so that there is kind of a baseline common understanding that everyone who is a PAVA recognized vocologist at least should be expected to have. So they have devised a test. Essentially, they give you study materials. In that, you have to identify a particular area of expertise that you have. So probably a primary and then also a secondary area of expertise in those vocology areas. And then you have a test that is specific to your discipline, but also causes you to demonstrate and knowledge and understanding of knowledge across those domains. So it's not just enough to know about what it is to be a singing teacher, but to know a little bit about all of those vocology areas. So if we come back again to this definition, like I said, anyone can claim the label of vocologist in much the same way, because no one owns that term, in much the same way that anyone can claim to be a singing voice teacher, right? Anyone can hang out a shingle and say, I teach singing lessons, and we have no idea what that means as far as their background. We may assume they have a degree in music or in voice performance. That may not be true. But we just have to assume that they're professional, but it doesn't tell us anything about the qualifications. So part of what the PAVA RV does is that it gives a more specific, if you say I'm a vocologist and I'm a PAVA recognized vocologist, now we have an understanding of, okay, that means they've passed this exam, they have a baseline knowledge and understanding across disciplines, and that's what they bring to their professional practice. So we see the same thing in what we offer at our program at the Summer Vocology Institute, is our graduates are then SVI trained vocologists. So it tells a little bit more, because if you understand the curriculum of what the SVI folks go through, then you know, again, more about the background information about what they've done. So we know why they might identify as a vocologist. So we'll dig a little bit into that curriculum.
So yeah, back in back in the early 90s, as the National Center for Voice and Speech was being formed at the University of Iowa, Ingo was already recognizing, along with Dr. Verdolini Abbott, that there was some more need for training than could be fit in any one curriculum. So we couldn't ever take an already full master's in voice performance program at a university of at a school of music and add in the necessary training that would bring them up to speed to be voice habilitators and vocologists, nor could you take the jam-packed speech language pathology master's programs and add in 3 or 4 more courses on voice production. And so it became clear that if we were going to add this level of education, it was going to have to be done in an extracurricular fashion somewhere. This was additional training. And so if we were going to propose that, and I'm saying we as a capital we, because I was not there, as much as I would love to take credit for this development. But if we were going to propose this type of education, what were the core foundations that needed to be taught? And so Dr. Titze, in this 1992 paper in the Journal of Voice, laid out the rationale for basically 4 areas that we needed. You needed enough background in the fundamental physics and biomechanics, mechanology is not a word, biomechanics of voice production that would separate you from speech production. So we understanding what is the voice source, the carrier signal, and how is that produced. So that was number 1. Then we needed to have an understanding, number 2, of the tools that you could use to provide a quantitative assessment and a visualization of that voicing if you were going to use that for either research or for education and training. Then in number 3, we needed some idea of habilitative practice that extends beyond the restoration of voice to its normal level. And then finally, we wanted to extend that to the extended voice use. So singing, acting voice, and I'm blanking more, but we wanted singing to include music theater and classical music and rock and CCM, though CCM wasn't determined in the 1992, but it was coming up very soon. And so so Dr. Titze ends his discussion here of saying the primary focus of this training is to meet the vocational and recreational needs of a particular individual, not simply to achieve a normal voice. So this is coming back to habilitating and capacitating these individuals who come to our studios or to our practices. All right, so our first course, then we set up a 4-course curriculum.
Programming note here, we're about 39 minutes in, so
hustle, got it.
We'll probably move a little quickly, yes.
Okay, fine. Thank you. So then we set up 4 courses that basically meet those 4 demands. We have our first course is the Principles of Voice Productions for 3 semester hours, and that's where Dr. Titze blows your mind about how the production of voice is governed by basic physical and biomechanical principles. Then the second course is the Instrumentation for Voice Analysis. This is an ever-changing course as our technology changes and as medical practice changes. We're responding with new tools and new assessments, and this includes the aerodynamics and the acoustics, but it also includes perceptual ratings and our listener questionnaires. And then number 3 is our voice habilitation course. This is taught by 3 different faculty using the Vocology textbook. This year we have Dr. Aaron Johnson from NYU, followed by Dr. Verdolini Abbott from University of Delaware, and then our final is Dr. Marco Guzman from Santiago, Chile, Universidad de Los Andes, I believe, is the name of the institution. And then our final course, Dr. Manternach teaches
Yeah, the Voice for Performers course, where we take all of what we learned in the previous 3 courses and try to get it to the rubber meets the road aspect, where we specifically look at for the performers. So we have someone who talks about the acting voice. Lynn Helding comes in and does a lot on cognition and motor learning applied to developing skill in the voice studio. We have one on developing methods for teaching, specifically exercises designed to lead to a specific outcome. We've added now a day on the transitioning voice, especially for transgender and non-binary singers. We have a day on musical theater. We have a day on CCM singing, a day on classical music. So again, all of the previous courses into now, how does that apply to the voice for the performer? We are not the only vocology program or the vocology center. There are many across the country and across the world, as you'll see here. Many of the folks leading these programs are graduates of the Summer Vocology Institute or the program at the University of Iowa. So again, the reach is getting out there as vocology is becoming better known and more widely practiced. So we can bring this home then of how vocology training influences us as singing voice teachers. One more time, we'll look at that model. Again, anyone who intentionally follows this model could potentially call themselves a vocologist as a singing teacher. I think then you could ask yourselves a number of questions in evaluating whether or not your singing voice teaching is using a vocology approach. You could ask if you are equipping your students for the specific sounds required in the genres that they want to sing. Are you enabling and capacitating them for the genres the sounds that are needed in the genres they're going to be singing? Am I capacitating them for the vocal demands of the singing we want to do? Rock and pop singers have very different demands than choral singers, perhaps, or those who sing in a church synagogue setting. Am I keeping up with the science and allowing it to influence my voice habilitation? And similarly then, am I observing my own practice with curiosity so that it can continue to evolve and inform my future practices? Can I recognize then with this interdisciplinary knowledge, I do not need to diagnose vocal health issues, but can I recognize warning signs or red flags that may mean I need to refer someone to appropriate vocal health professionals in the vocology, under the vocology umbrella? And if I do have a student who needs rehabilitative care, can I play a meaningful role as part of that voice care team as the singer, to recognize what my role is and isn't, but to understand what's happening in their voice therapy to the degree that I can make sure that I am not doing anything counterproductive to that, but I'm helping that process. And then lastly, can I advise my students about vocal health and hygiene without, again, stepping outside my scope of practice? I am not a nutritionist, but it's good for me to help them know what impact certain foods, hydration, medications can have on the voice, while also acknowledging that I will not be prescribing medications and I should not be telling anyone that they should not be taking prescribed medications, but to have a curious mind about what that might do to the body and how it might influence the voice. So if you want to know more about our program in particular, the Summer Vocology Institute, you can find the Summer Vocology Institute tab on vocology.utah.edu. There's a greater breakdown of the courses and the faculty and a lot of instruction about or information about what it is that we do. And in any time that we have left, we welcome any questions or comments.